All right, I think we will get started. Want to welcome everyone, thank everyone for joining us for this webinar. Certainly appreciate everyone taking the time out of their day to be here with us. My name is Will Grove. I am the Helpline and Resource Director with the Brain Injury Alliance of Arizona. I'll be co-hosting and I'll be helping out with the Q&A section. If anyone has any questions throughout the course of our presentation, I'll try and answer those live if I can. And then any questions when we get to the end of the presentation, we'll make sure that we kind of track back and go back and answer those. So definitely feel free to utilize the Q&A section. It looks like the chat itself is going to be disabled for this presentation. So please use the Q&A the Q&A part if you want to reach out to us. And then just a heads up to everyone, we are going to be recording this as well. So just everyone's aware of that. But I think without any further ado, I will turn it over to Aimee. And Aimee, welcome. Thank you for joining us to do this presentation.
Yeah, hello everyone. Thanks for having me today. I'm just going to go ahead and share my screen and get started. So give me just a second. And hopefully try to get my slideshow view, but I gotta change my view a little bit here. I can't move my toolbar. Give me just a second. Stop sharing for a second. If I need to change the view, I think that's my problem, Will, where I can put it on the side so I can see the.
Oh, go back to screen share.
Okay.
And then do slideshow. I jinxed you because I complimented you. Click on slideshow. You want the
Yeah, I can't see it because the toolbar's up there from Zoom. There we go. Got it. Okay. Sorry, everyone. Let's try that again. So thank you for having me today. It's a little bit about myself. I'm an occupational therapist. I do work in pediatrics. My specialty areas are sensory integration. And so just talking with Will and Carrie and about some things. And I know that sensory processing can be some issues and with brain injury and after brain injury. And even though most of my work's in pediatrics, a lot of the evidence and research and background in sensory processing came from adults. And so I thought it might be a nice topic to cover. So I'm going to be just briefly going over some things about sensory processing. So let's get rolling. So if I have just a little background on sensory processing and acquired brain injury, we after a brain injury, the brain is reorganizing. In sensory processing, a lot of our sensory processing takes place in some of the lower levels of the brain and the cerebellum and the premotor cortexes, and our higher cortical areas are reorganizing after an injury. And so those cortical areas are responsible for modulating and organizing sensory information. So it processes and comes in through usually the cerebellum area and then heads up to the higher levels of the brain to be organized and processed and then utilized. So we make our responses based on our sensory input. But as you know, after an brain injury, that can be difficulties with that organization piece. And so as a result, we might have some sensory processing difficulties that were not present before. We do know, and all of us have various sensory processing, and sensory processing can change and vary throughout the day based on a lot of different factors, which we'll talk about in a few minutes. And so as the brain even heals, sensory processing can change. So what are some of the causes? There's a really nice study I read. It was a meta-analysis of just looking at sensory sensitivity after acquired brain injury. And some of the reasons that we have that are there's changes in some of the functional abnormalities in these areas that you see on the screen. And then abnormalities in the brain networks exist after an injury. And then we also have that decreased organization piece in the higher cortical areas of the brain. Those are our main causes for sensory processing difficulties after a brain injury. So what is sensory processing? So the next few slides, I'm going to talk about what sensory processing is, and very much from the basic standpoint of who we are as sensory beings. So Dr. Jean Ayres is the founder of sensory integration theory. It's a theory that occupational therapists utilize, but it does also has influenced in other areas of the field, psychology as well. But she defines it as the process by which people register, modulate, and discriminate sensations received through the sensory systems to produce purposeful, adaptive behaviors in response to the environment. So in a nutshell, we're constantly taking in sensory information through our various senses, which we'll talk about those in a moment, and our brain organizes it and we produce a response to that sensory stimuli. So here's just a little, I love to use this house because I think it explains the importance of sensory processing. You can see down here at the bottom is our foundation where all our senses are. This is our tactile, vestibular, proprioceptive, olfactory, gustatory, visual, and auditory formulate the foundation of our house. As the sensory inputs come together, then we have the body of our house, or where we live, which is knowing what our body scheme is, our motor planning abilities, postural security, being able to balance, walk through space, knowing two sides of the body. And then the roof of the house, after we have the base foundation, is our higher cortical areas of attention, coordination, eye-hand coordination, auditory and language, visual, spatial, fine and gross motor skills. But everything comes from that foundational piece of sensory processing. So we can't get to these higher areas that we need to do our day-to-day tasks if we don't have adequate sensory processing. So I'm going to go through each of the sensory systems and just kind of what they mean in sensory integration theory and sensory processing. Some of them are probably quite familiar to you and some might not be as familiar to you. So we'll just kind of go through all of them. So the vestibular system, its receptors are in our inner ears. We know that it is responsible for balance. It detects movement. It lets us know which direction our head is in, if our head is upright or not upright. It is response to the pull of gravity. It has a very big influence on our vestibular ocular reflex, which is what causes the eyes and our movement system to work together so that we don't have, so that we have a stable visual field even as we're moving through space. And vestibular processing has a direct impact on our arousal levels and attention. It's really our movement system. We utilize our movement system all the time to change our levels of alertness and to help us attend. So we'll move around if we need to wake up a little bit. We also use movement to calm ourselves down. And so vestibular is really a very important system in our sensory integration theory. And if you've ever had vestibular difficulties, you know how debilitating it can be. So it's just a small little system inside our inner ear, but very, very powerful in what it can do, what it does for us. Proprioceptive system, those receptors are in our muscles and joints. It's responsible for our body awareness, how much force we use when we move, and grading that movement. So that's how you know how hard to shut a door, or sometimes you might misjudge the door and you go, oops, I slammed the door and I didn't mean to. That's your proprioceptive system. That's grading that force of movement. Together, vestibular and proprioceptive systems are responsible. They work very closely together for postural control, for body awareness. They really are a foundation of our postural abilities, our movement through space, and maintaining upright positions. So they work very, very closely together. And they're kind of our hidden senses where you think like people don't think a lot about them when they think about our sensory systems, but they're very important for us to know who we are and where our body is in space. There's some on that. The tactile system the skin is our largest sensory organ, so we take in a lot of information through our skin, and lots of tactile information comes in. So we're going to get information about types of touch, where we're touched. Different types of touch are alerting to us. Light touches tends to be alerting. Deep pressure is calming. We know that because if we go get a massage, that deep pressure is a little more relaxing versus if someone brushes up against me, that's going to alert me to, ooh, what was that? Who touched me? Tactile information is really very much, if we have disruptions in tactile processing, because we take in so much information through our skin, that can be really disruptive to us and really cause us to be in a state of high alert. For our auditory and visual system, so the auditory system is adjacent to the vestibular system. They work very closely together as well. We have to localize sound, we have to discriminate sounds, as well as just alerting it to us. So the auditory and visual system are our two sensory systems that tell us our distances senses. So vestibular, proprioceptive, and tactile are about my person, my body, and auditory and visual give us information about our environment from a distance. So they are very much designed to be an alerting system. I can see something before it's right on me, right? I can hear something before it comes close to me. So these systems are designed to give us information about the distance in our environment, and therefore they're really designed to be can be designed to be alerting. So if I have processing difficulties in these, it might cause me to be on high alert a lot of the time. Our visual system is our most dominant sensory system. We will always use vision first. And if we have trouble in our other systems, especially proprioceptive, vestibular, we'll use vision to compensate. It's our most heavily relied upon sensory system. And it's we have oculomotor, visual perception, all those things go right along with the visual system, besides just like seeing what we see. It's also how we see and what we see. And that's a visual perception. And then olfactory and gustatory. Olfactory is our smell system. It has a direct connection to the limbic system, doesn't pass through anything on its way there when it's being processed. So our limbic system is our emotional system. So we have a lot of emotions usually tied to smells. And sometimes those can be positive or negative. So if you have some sensitivities in olfactory, that can be a very noxious stimuli sometimes, or very pleasant. Taste is definitely can have some impact on our arousal levels. Very important for feeding and eating, oral taste, and then sometimes just even oral taste in our environment. So when we think of sensory processing and sensory processing differences, all of us have various levels of processing. We call this in sensory integration theory modulation or reactivity. So this is what most people would think about when you say sensory processing. Oh, it's too loud, it's too much, I can't handle, it's too itchy. Those are things that we usually will think about with sensory processing. And those are on a spectrum. So we have a hyperreactivity or hyporeactivity. Hyperreactivity means it doesn't take very much stimuli and I will respond to it. I should be able to filter that out, but if I'm having a difficulty in sensory processing, I'm hyperreactive, then I'm not going to need as much stimuli to elicit that response. On the flip side, hyporeactivity means I need a lot of stimuli to elicit a response. Sometimes it might almost seem like I didn't notice it at all. I see this sometimes in with equilibrium reactions. We'll have working with clients that seem to not have an equilibrium reaction when really they're just very hyporeactive. So it takes a long time to elicit that to come to register that body system is moving. If you're hyporeactive, it just means you need a lot of input. So sometimes it's like, oh, I need to go, I need to take a walk, I need to get, or I think in kids a lot, I'll see these kids are, they'll be on the playground swinging. It's like, you can't get them off. They just have to keep going and keep moving and keep moving. So some different things to think about. When we look at the research in sensory reactivity following brain injury, we see a lot. Most of the research is in hyperreactivity. There really wasn't a lot, and there isn't a lot on hyporeactivity. So that's just something that further research would need to be done on, or is there just not, it's maybe not as noticed or debilitating. I know a lot of times when I work in pediatrics, the hyperreactivities can be very disruptive to the day-to-day routine. And so therefore they're noticed a lot more quickly. And then sometimes our hyporeactivities. But we can see hyperreactivities in any of our sensory systems except proprioception, which I'll talk about a little bit more later. And all of those can be, maybe with auditory, it's too loud, I can't handle noises in the environment. Sometimes it's just small noises that I should be able to filter but can't. Visual, it's a lot, sometimes it's just too many things around, too much to filter out, things like that. With movement, if I have hyperreactivity to movement or vestibular, that's really gonna have, I'm gonna have trouble. I might have trouble with riding in a car. Sometimes I can't lean my head over to get something off the floor, things like that. So here's just some potential things that you might notice or might have, as each of us have different sensory processing. Background noise becomes too much. I think we all know that if we're in a noisy environment, we're a little bit more on high alert, or if we know we need to calm down, or it's like, you know what, I just need to have some quiet time. I need to go in my room where it's quiet. I don't need to be around. I equate that a lot sometimes. If you go to you're going shopping around the holidays, it's very busy in the store. There's a lot of people. And it can be stressful, even if we don't have sensory processing difficulties. So that's sometimes how, if we have sensory processing difficulties, it feels like that all the time. It's always this like very noisy, loud, bright, lots of people environment, and our nervous systems can be in a state of high alert because of that, and stressed a lot. So those are things like excess noises, bright lights, clothing, if you've got something that's itchy, and I think an unexpected touch, even just like unexpected touch when someone bumps into you, that can cause your nervous system to go into high alert. Very strong smells. We talked about how that's related to our limbic system, so that can be very emotionally tied to us, and to things that we have. So when I'm looking at those sensitivities, I can see how can be a bit disruptive to the day-to-day if I can't filter out or process this information. So as we talk about sensory sensitivities and sensory reactivity, that impacts our levels of alertness. So when I am thinking about the response to sensory input, the modulation and reactivity will influence my alertness level. Each of our tasks that we have every day requires a different level of alertness. So for example, if I'm going to the gym, I need to have a higher level of alertness. And so I'm going to do things that are going to help me come up and be more excited or more awake. On the converse, if I'm going to bed at night, I want things that are lower level. So each task does have a different requirement for a level of alertness. And our response to the sensory input impacts our level of alertness, such that the alertness may not match the task. That's when we have a mismatch and a sensory processing difficulty or difference that we might impact. Because if my alertness level is not at the right stage to do the task, then I'm not going to be able to get the things done during the day that I need to. And so that's where sensory processing differences can come into play. We also have sensory discrimination, which looks a lot sometimes with like a hyper or hyporeactivity, but it's more about like the type of. So it's the perception and interpretation of sensory input. It's not just like, okay, I get that there's noise going on, but I have to know what kind of noise it is. Where is it coming from? Is it important for me to listen to and pay attention to, or can I filter that out? So sometimes this looks like a modulation or reactivity disorder, but usually the person will be a little bit more on your stable versus variant on the processing. And it also will oftentimes lead to some difficulties with sensory motor disorders, because if I'm having trouble, especially vestibular, proprioceptive, or tactile, I don't get good feedback from my environment on what I'm doing and what my body's doing, and therefore I might make the wrong motor response. So I talk about with kids that have motor difficulties from a sensory processing standpoint, if my brain didn't get the right information, I'm not going to make the right motor response. So a nice example is if you're going to get a Coke can, and you think that Coke can is full, you're going to use a certain amount of force. But if it was empty and you thought it was full, you will use too much force to pick that up. If your sensory processing is good, you'll make an adaptation and hopefully not drop it. But the reason why you used too much force was your brain didn't have the right information. You thought it was full when it was empty. So your brain didn't get the right information. It's the same thing in our sensory processing. The brain doesn't get the right information, therefore it can't make the right response. It just didn't get the right information. So that can be difficulty sometimes. Like lots of times when you're thinking, I know what I'm supposed to do, but I can't get my body to do it. So let's look at some of our behavioral responses to sensory processing. So if I have overstimulation, so back to the example in the mall, it's busy, it's the holidays, and I have a behavioral response to that, I might become overstimulated. And that means my nervous system is in a state of heightened alertness. And sometimes we have sensory processing differences. We might be walking around in a state of high alert all the time. So then that can make all of our other things different. Oh, a little thing could set me off, and it's just because I'm in the state of high alert all the time. I'm not able to deal with stressors as much as if I wasn't in the state of high alert. So when you come home from that busy shopping experience, and then your son or daughter comes in and wants it, mom, you probably might be a little bit shorter with them than on a day where you're a little bit calmer. So it's the same thing. If you've got a lot of stimulation, your nervous system is in a state of high alert. Triggers can then easily move a person from a semi-heightened state to a state of overstimulation, or even to a state of out of control. And sometimes that can happen really quickly when we have sensory processing difficulties. And response to overstimulation can look like anger, but it's really just, or it can look like out of control behavior. So those are just really responses where I'm already kind of at, sometimes parents will say, oh, he goes 0 to 60 and no time at all. And it's like, well, no, he's sitting at 55 all the time. That's why it looks like he goes 0 to 60, but he's at 55 all the time and just kind of holding it together. So then that trigger comes in and we're over the top now. Also be aware of shutdown. Sometimes we get so overstimulated that our brains just shut down, and then we can't really process much of anything. So in occupational therapy, we look a lot at different aspects. We talk a lot about participation and tasks and helping people do the things that they want to do in the day. And when I look at sensory interventions, each of our daily tasks require different levels of energy, different amounts of energy, and our energy is finite. We have limits on our energy. Each task requires different types of energy: sensory motor, cognitive, psychosocial. So think about a task that you do every day. And so let's say brushing your teeth. Brushing your teeth has some sensory motor components. Typically, it doesn't have a lot of cognitive components because you've practiced it so much, you usually don't have to think about it. And there's probably not a lot of psychosocial, but a little bit, because you're probably brushing your teeth because it's the socially acceptable thing to do, right? You don't want to have bad breath when you're talking to people. So there's different elements. That's a more high motor task versus cognitive or psychosocial. But meanwhile, you're sitting here in a webinar, so now you have to focus a lot on the cognitive part, more so than the sensory motor. There's not a high motor demand in this activity. There's some sensory, obviously. You've got to process the auditory and visual input, but you also do a lot of cognitive thinking. So when I look at a person, or when we think about sensory processing and sensory interventions, what does that do? Well, if I'm having to spend so much of my energy trying to regulate my sensory processing, I don't have as much cognitive energy or psychosocial energy. I'm really not able to do those other things, like maybe my work tasks or my school tasks, or socializing with peers, because my sensory systems are taking up too much energy. So if you can help those sensory systems process just a little bit better or not take so much energy, then you're going to free up your energy for other things that you need to do throughout the day. So what do we do about sensory processing differences? Well, the first thing is that you really want to identify your own sensory processing. And everybody has different sensory processing. In occupational therapy, there's a lot of assessments that we can do and observations we can do to look at sensory processing. But we also just know our own selves pretty well too. So those behavioral questionnaires, and I'm going to try to attempt to show you guys one in a minute, just to show you what it might look like when you're going through your own sensory systems. So just so that you know how you process things. And then the next step is to then identify where your sensory triggers are. So if I have a sensory trigger, I know I can prepare an intervention for that, or I can prepare a way to help me not have that sensory trigger. The next step that you want to do is kind of look at your environment. Is there something I can change sensory-wise in my environment so that there's not as much input, or it's input I'm better able to process? And then implementing calming strategies when you become overstimulated. So once we're overstimulated, we need to have a toolbar. I call them a toolbox, a sensory toolbox of interventions, of things that we can do that help us calm. And so when we have a overstimulation. So let me see if I can show you this system. This is just an example of a sensory questionnaire. And it's just a symptoms checklist. This can really help you understand your own symptoms. There's lots of them out there. There's formal ones, there's informal ones. This is just an informal one to help you know about your own sensory systems and what some of your triggers might be. So there's all kinds of them out there, and this is just one, and it has all different types of your sensory systems, over responsive, under responsive. So there's lots of things to think about there. Back to my PowerPoint. Okay. And then just thinking about, am I hyper, hypo, do I have discrimination in each of my 7 sensory systems, so that you can know a little bit about what your triggers might be. When I'm looking at environmental modifications, obviously sensory stimuli comes in through the environment. We have lots of ways that it comes in, and we can be careful, and we can modify the environment or our own environment to help us when we know we have a sensory trigger. So some things to think of: vestibular. If I'm hyperreactive in vestibular, that movement can be disruptive to me. But we also know that visual will play a role into vestibular. So I can use visual to help me, but also visual can trick your vestibular system as well. So sometimes just the way something looks can make you feel nauseated or off balance. So be aware also of visual and your visual space. Keeping your feet on the floor, making sure you're staying grounded, as well as using stationary chairs, maybe chairs. I like to sometimes have chairs with arms on them. You feel a little more secure in space, and just making sure that you have that kind of groundedness and using your proprioceptive and tactile systems to help. With tactile, be aware of like what types of clothing work well for you. Sometimes it's just the fabric of the furniture. If I know that like maybe fabrics are difficult for me, then I might make sure that I have some soft clothing on so I don't have to touch the fabrics that I'm sitting on or things like that. Closeness to people, unexpected touch from others can be very disruptive, and that just happens in busy environments, right? Or when people are close to you, or some people just don't have as big of a bubble. So being aware of like how close you are to people. With auditory, some good environmental modifications. You can use noise dampening items like fabrics, furniture, panels. Move your sitting position, so find those quiet areas. Take quiet breaks, build those into your day where there's less noise and less visual, especially if you have a job that has a lot of that stimuli in it. And then with visual, you can use different contrasts. You can lower your lights, close the shades, keep things clear and uncluttered. That's a really big one. Sometimes our desks or our spaces in the kitchen get busy and there's lots of things. Put things away, put them in cupboards. It helps keep that visual system not having to process so much. And that's just a small thing you can do to really help. If I'm thinking about the sensory environment, and once I've identified my triggers, I know that, you know what, sometimes I might need to do things during the day, but this might be a trigger for me. So I'm always plan ahead, like know where your environment is, know what's in the environment. Try to make sure you have a space or a time. If you know it's going to be very overstimulating environment, build in times where maybe I just need to go outside for a little bit, or I'm going to take a bathroom break, or things like that to get in less stimulation. Monitor your own level of alertness. So keep your eyes on that. Start to recognize the way your body system changes as you're going through different levels of alertness. And then know what you can modify in the environment and know when you need to change environments altogether. Sometimes we just find that environment is not conducive for us. It's too much stimuli, and that just might not be a place we want to go, and if we can avoid it, just not to go there. So those are just some different things to think about in the environment and the sensory environment, and knowing that there's some things we have control over and some things that we don't. Some of our strategies to calm, and this is specifically when we're going to talk a little bit about each of our sensory systems. So movement can be very calming, or it can be very disruptive. So you need to know what movement works for you. Taking a walk is a great thing to do. It's very organizing, rhythmical. Using a rocking chair might be great for you, or a swing of some sort. Doing some pacing. A lot of us will just pace or have an infinity walk kind of pattern. Maybe that's in your backyard or in your room or at your desk. And so movement can be calming, but it can be disorganizing. So make sure you know your own movement system and what works for you. Proprioception and deep pressure tactile are two inputs that are always organizing. Proprioception kind of organizes all our sensory system. You cannot over respond to proprioception, so we consider it an organizing system. And deep pressure tactile is also just calming to the nervous system. So these are two types of input that I always have in my back pocket if I need to calm or I know a environment is going to be overstimulating. There are also things I would suggest to build just into your daily routine so that you can, if you're kind of, our sensory will go up and down, and if I can kind of just put in some deep pressure tactile and proprioceptive throughout the day, my peaks and valleys may not be quite as much because it keeps my systems organized. So proprioceptive is anything that's like body weight exercises, lifting weights, fidgets with resistance, lots of those activities that we might do even for other reasons like fitness or yoga that have those good weight bearing positions are really organizing from a sensory standpoint as well. Deep pressure tactile, there you can do your own. I do teach my clients to do their own arm and leg squeezes, or sometimes they'll squeeze their hands. Those are all great things to do. Putting your hands between, sitting on your hands, those are calming strategies. Weighted lap pads, weighted blankets, massages, building into that massage into your routine sometimes can be really important. With auditory and visual, auditory, we can decrease the sounds that we hear. We can use earplugs. Sometimes just putting a hood or a headband over your ears helps dampen the sound enough that it's not as overstimulating. With visual, a hat is a good thing. It can block a lot of those lights that come in from above. Wearing sunglasses, sometimes even indoors. If you've ever kind of been in those big box stores and you walk in, it's like sometimes I don't want to take my sunglasses off because it's just less stimuli. And that's a good strategy to use sometimes because it's just can be a lot of visual information in some of our environments. I did talk a little bit about the sensory toolbox, so I wanted to just spend a little bit of time on how to develop your sensory toolbox. And it's really, I've given some simple strategies or tending to be calming strategies, but really it's like looking at your day and what kind of things help you calm and building those in throughout your day. So the most important thing to do is really know your own sensory processing and know your sensory triggers. If you have something and you're like, you know what, I know some of us know immediately, you know what, I cannot handle that type of shirt, right? That's too much for my nervous system. If I have that shirt on, I'm going to state I'm not going to be able to focus on anything else the day. And that's important to know too when we look at sensory processing. Forgot to mention this earlier, so I'll mention it now. Cognition can override sensory processing, but only to a point. At some point, sensory processing will take over and we can't ignore it. So it's a piece like, I'll use the example of, let's say that there was, I'm not a big fan of spiders. If there was a spider crawling on my back right now, I would have to attend to that no matter how hard I tried to stay focused on what I was saying to you guys. I would not be able to ignore that. Eventually my cognitive system would not be able to filter that or hold that or keep that down, suppress that. I'd have to take care of that sensory stimuli that was noxious to me. So we can use cognition to a point, but that's going to tax our cognitive system. So that's why it's important to know your sensory triggers, because sometimes we're using a lot of cognition to keep us together during the day, and maybe that might exhaust us at night, or I've used too much cognitive energy and I can't do my job now because I'm focusing so much on keeping myself together. So be aware of that when you're trying to identify your own sensory triggers, to know that sometimes I might be trying to modulate this. So be honest with yourself about what is a trigger, and pay attention to those things and write them down so that you know what they are. And then you'll want to identify 2 or 3 strategies for that trigger. I usually will say, think about the environment, like what environments does this happen in, or is there something I can do? Okay, it's always too loud when I go to the grocery store. It's just a lot with the shopping carts and people are around, so it's too much noise for me. So you know what, I'm going to wear a hoodie. I'm going to keep my hoodie up in the grocery store so that I don't have to filter as much sound, and that might just be enough to get through the grocery store. So that's an example of how to create a strategy. And then I also would always have like, what's my strategy to calm if it gets too much? Is that going to be, I'm going to wring my hands, I've got a fidget in my pocket, am I going to move environment? What are my strategies for each of those triggers? Write those down, and that's your kind of your calming kit. Do I need to have items with me? Maybe I keep those in the car or keep them in my backpack, so I can have a calming kit to keep my nervous system a little bit more organized. I always am thinking about like, where are my quiet environments? What are the sensory features of the environment? Where can I go that would be more conducive to my sensory processing so that I can still participate in this activity? Looking for areas in the room that don't have as much sounds or less lighting, or different types of lighting. So those are things that you can really look at and when you're creating your sensory toolbox. So I think I'll just summarize, and then I think if there's questions, we can spend some time on that. But sensory processing is something that all of us, we have various levels. Lots of us already use strategies throughout our day to keep ourselves organized, to keep ourselves to be attentive, to do alert level to do the tasks that we need. But sometimes our sensory processing is not what it is, impeding our ability to do our daily tasks. And a lot of times after a brain injury, that comes in the form of hyperreactivity, which means it's too much. I can't process my movement system, my visual system, my smell system. Can't process those things. It's too much for me. And now my nervous system is in a state of high alert. So everything else is hard for me. I'm using cognition to try to organize myself. I'm trying to stay calmer, but I'm not. I'm reaching those thresholds very quickly. So all of that can be taxing and disruptive to your day. So if you can identify your own sensory processing and know a little bit more about sensory processing of yourself, and then creating those that toolkit and identify after you've identified your sensory triggers, that can help keep you a little bit more ready to do the tasks that you want to throughout the day. And also very important is to develop those healthy habits, those sensory habits that keep you organized throughout the day. So if you know that you tend to be hyper reactive, build in some of those calming strategies like proprioception or movement throughout your day so that your nervous system is calmer overall and better able to deal with those hyperreactivities as they come along unexpected, because it's going to happen sometimes, right? We can't plan for everything. And so if we can keep our nervous system at a little bit less overstimulated level, then we can deal with those unexpected triggers a little bit better. So I think if that's good, I'll stop sharing and we can just open it up for any questions. I don't know if it's in the, well, if we have some already.
We do. We have a really interesting one from Lori. Lori was asking about severe hyperacusis and extreme nerve pain, and if after injury, you know, that can be so severe that essentially someone can't even stand to have material or fabrics on their skin at all.
Yeah. So I'll talk a little bit about auditory sensitivities, and then I'll talk a little about the nerve pain is a little bit different than tactile, but I'll try to give you a few strategies that would work with that. So yeah, I mean, and the thing is that as your brain heals and things happen and change, then our sensory processing will change. But we also know, and in sensory integration theory, the brain is very plastic, which means we can create those new routes, right? So we have room to help the systems process better even after injury. So there are various interventions to help that auditory system. We use some different auditory interventions at the clinic that help the brain make an adaptive response. And that's really how you help to change sensory processing. If I can give little pieces of information to the nervous system and the brain, and then it has an adaptive response versus a maladaptive response, then I can build on those. And what happens though so many times with sensory processing is that everything is too much. And so it just becomes almost a scary environment, you know? I mean, if it's too much it's too loud, I don't even know. And so now I'm not even going to go into any environment because it could be too much for me. And when you have I call them sensory memories, because they're very powerful. If you've ever had a really noxious reaction to sensory stimuli, you're never going anywhere near that again. Like I think about when I got motion sickness on one time I mean, I was terrible on a boat, and I don't think I've been on a boat since then, right? And that was 15 years ago. But that's how those sensory memories are very noxious, and it's protective. It's protection. Our bodies want to protect it. Our brain wants to protect us, and so if it's noxious, it's not going to do that. With nerve pain, that's a piece that I didn't talk a lot about today, but there are some there's tactile pieces of that, and then there's also the interoception piece of that. Now, what you do know and how sensory processing can play a role in even things like nerve pain is that if you have a calmer nervous system, and I'm using that deep pressure tactile to really get the rest of my tactile system more organized, then I should have decreased response to pain. It's not going to go away by any means, but it can help maybe bring that a little bit more under control.
So yeah, we had a few more questions coming in. Let's see. Lori asked about massage, and that, for a lot of people, massage is supposed to be calming, but Lori's experience is the exact opposite. It's too much touch. So the question, and normal's in quotes, is that a quote unquote normal trigger?
Yeah, Lori, I'm right there with you, actually. I can't stand massages either. I'm just a little on the more hyper side of tactile myself. So then that's just not going to be something for you. Deep pressure is still going to be calming, but you might need to give that to yourself. So there is something that is, and things like weighted items might be better for you versus like someone else touching you can be a bit of a trigger. So it's not always, a massage may not always be calming, but deep pressure tactile is going to be calming, if that makes sense.
And Julie has a question. Oh, this is an interesting one. So Julie's asking, many OTs with whom she's worked have encouraged exposure therapy to utilize neuroplasticity to decrease sensory processing hyperreactivity. And she wants to know what your thoughts are on exposure therapy versus use of these strategies to just cope.
So exposure therapy, if it's done in the essence of I'm facilitating an adaptive response, then it's good, and it will work, and it will help you process sensory input better. We do that. I mean, that's outside of that's what we do, is we help kids. I work with kids. I help them process the interventions, process sensory input better. So I don't need all these strategies, right? But exposure therapy that's just repetitive exposure does not have good research behind it to that, and it doesn't really work for sensory processing, because if my brain interprets it as noxious, it will always interpret it as noxious unless it's done in a different way. And we utilize other sensory systems to help that. So auditory, for example, if auditory is my one that's hyperreactive, I'm not going to just expose someone to a lot of noises. We're going to help the nervous system calm and organize using vestibular and proprioception and tactile. And then I can bring in the auditory so that when I respond to auditory, when the person responds to auditory, it's not noxious. And so that's a sensory and a kind of integration and sensory processing way of thinking versus just an exposure therapy. And so if it's, kind of done in that method, then yes.
Let's see. Loving the questions we're getting. These are really, really fascinating. Scott has a question about eye brightness issues and sensitivity to light. And the question is, does that eventually get better, or is it something where it's more you adapt? And the example Scott uses is, do you kind of wear sunglasses the rest of your life, even in the big box store?
I think I have not seen as much success with visual hypersensitivities as other sensory systems. However, when I look at that, the big thing is to utilize that vestibular piece to be calmer. If my nervous system is more calm in general, then I can better tolerate those sensory systems that are hyperreactive. So if I knew that like lights were a big problem for me, I would make sure I was very calm by utilizing some of my proprioceptive, tactile throughout the day before I went into that very visually stimulating environment. And so that's kind of that aspect too. And then with a visual system, you can also use you can still use your cognition too. Like think about you're focusing on what am I going to look at versus to try to block some of that visual stimuli. But I haven't just as much research on the visual sensitivities. There's not as much out there as some of the other systems.
A follow-up actually, in terms of that tip for making sure that you're cognitively actively trying to focus on one thing. Is that something that's helpful to maybe when you're at home kind of practice? Like, is that a skill to kind of practice and work on so that when you're out in the environment, it comes a little more easily?
Yeah, that's actually great. That's what I teach. Again, I teach the parents to practice those things with their kids when the child's calm. So that then when those stimuli that maybe comes unexpected, you're already prepared and know what to do. So absolutely practice those things. When you've got your toolbox together, practice them when your nervous system is calm.
Let's see, we got two more came in. Linda wants to know what is some obviously there's a lot of technical language surrounding sensory sensitivity, as there is with every every subset of the medical field. So Linda was asking about what's some helpful basic language to explain sensory sensitivity to family and to friends.
I try to find someone has a sense, everybody has some sensory sensitivity, right? So sometimes I'll try to find that whatever that sensitivity is. So like when I talked about the example that I usually use is that holiday shopping, because somebody's probably been in a situation where you're like, and you get there and you're like, wow, I was really short with that cashier. And I don't really know why I was short with that cashier, but because it was too much noise. So I do like to use that language of too much and too bright are really a lot of things that people can understand. And I also will kind of just say, like, you know what, think about a time when maybe either you got motion sickness, and that's a good one to use because it's such a noxious one. If someone does have some motion sickness, they'll be like, remember that was too much movement for you, and how did you feel? And it wasn't anything you could do about it, right? You just got sick. You couldn't cognitively reason through it. So trying to find those things. Tactile is another one that I can often use to explain that, or olfactory, because somebody's got a smell they don't usually like, they find noxious. That's a good way to relate to them. And there's really nothing you can do inside your brain to say, I like that smell. It's noxious to you. So trying to use those pieces so that they understand that it's not something that I'm choosing to do, or it's not something, it's like my brain is actually processing this as noxious. And so I find that can be a hard thing for people to understand, because they think that you can just be like, oh, it's okay, just tolerate it. And it's like, that's not how it works. So if I can find something that they can relate to, I find that's the best way.
And I can say for tactile, that the spider example, I don't even consider myself to be arachnophobic. But when you said that and I thought about it, I was like, yeah, if there was a spider on my shoulder right now, I would be falling out of my chair. Like I would not be able to focus.
Right.
I think that's a great, very relatable example. Selena has a question about, let's see, so how is uh, someone separated from autism versus someone who is not? So how is someone with autism as opposed to someone who's not experiencing these sensory issues? I believe it, and Selena, you can correct me. I believe the question is about how someone with autism and sensory issues maybe experiences these as opposed to
Yeah.
as
Okay.
opposed to the general population in terms of sensory
Sure.
stimulation. I may
Yeah.
have jumbled that one, but
Well, hopefully, if I don't answer the question, just let us know. I'll try. Yeah. So sensory processing. I mean, I work with a lot of autistic children and young adults, and mostly we are working a lot on sensory processing. And so it is even part of the diagnostic criteria is that there's sensory processing differences in the autistic population. And so that just tends to be that when we talked about that spectrum, the hyper and hyporeactivity spectrum. Each of us do have different levels on that. When it comes to needing a sensory difference or sensory processing dysfunction or difficulties, it's that those the way I'm processing is so much in one of those realms that I can't do what I need to do during the day. So that is where it's like, yeah, some of us we just have different levels of sensory processing that makes us who we are, right? That actually guides our occupations and what we choose to do. If you're a mover, you probably don't have a sedentary job, right? So our own sensory processing does drive us towards different things we like to do. But when those hyper or hyporeactivities are so much that I can't do the things I want to do, I sometimes it's so much. I think someone mentioned the auditory is like I can't even go into an environment, or I'm so sensitive to tactile. I can't even. There's only one outfit I can wear. That's a problem, right? So that's when you want to get some help. And it's even thinking about not just sometimes we'll think, oh, it's I can't do these things or it's hard for me, but am I so overwhelmed by sensory input that I'm just stressed all the time? We don't want that too. So there's interventions that can help that in anybody with sensory processing, regardless of what their diagnosis might be.
And Lynn has a very interesting question. I'm not sure if we can necessarily answer it in this setting, but I'm curious to pose it. It's kind of a state of the industry question.
Oh.
It's a really interesting one though. So Lynn, let me make sure I have this correct. Um, where did it go? Here we go. So Lynn was asking about retained primitive reflexes, and she's finding in terms of trying to find treatment for it, she's finding that in her search, pediatric providers are doing work with that, but adult providers, she's struggling to find ones that really do treatment with that. And if there's a reason for that, if treatment is more effective for at a young age as opposed to an older age.
Yeah, so
Um,
I think you'll find that a lot in almost anything that's related to sensory processing and primitive reflexes. And Len, I just been doing a webinar on primitive reflexes and sensory processing. But anyways, it's the same thing. It's just the pediatrics, it's covered well. I mean, it's by third-party reimbursers, and it's just not really covered in the adult population as much. And so then, of course, that just drives it like, okay, if you want to do even like in sensory integration, it's like you can't find really an adult only provider. It's pediatrics, but we'll treat adults. But yeah, it is the nature of the industry and the reimbursement structure for the most part, that we see that there isn't really necessarily evidence that says, you can't do it or it's not effective, but there's not evidence one way or another because we just don't do it a lot. So we need to make some changes on our side of things.
let's see. I think oh, and Lynn was clarifying that her with hers it is uh the primitive reflex is directly related to a brain injury that
Mm.
she experienced.
Oh,
Um,
yeah.
let's see. Lori has a question. So Lori is 2 years post-injury, still struggling with sensory processing. She's been released from OT for almost a year. Her question is, is that something where she should maybe be going in to be reevaluated if she's still experiencing these symptoms, but not getting that treatment?
Yeah, I always am. If you're still experiencing symptoms or your symptoms will change, there's lots of things that happen in life with sensory processing. It does change over the lifespan. So absolutely go back in. Even with my pediatric patients that will discharge, and then sometimes they say they need to come back in for a little touch up. So I would definitely suggest go and get evaluated again and see if there's some other interventions they can get going, kind of just touch it up a little bit, get it, or maybe if you have new symptoms that have come up too, that's definitely.
I think a good rule of thumb is when in doubt, go when in doubt, check it
Yep.
out, or
Yep.
I'll workshop that phrase. Um, so let's see, that might be the end of our questions. Indefinitely. Oh, Lynn had a comment that she's been going to an upper cervical chiropractor as her C1 vertebrae is directly related to her CNS issues. I don't know if you have experience with clients who are doing that treatment as well.
I have, well, I think I had one client that did that too. I don't know a lot about it, but if it's effective, keep it up.
If it works, why not,
Right.
right?
I'm just gonna drop my email in the chat too, so if anybody, welcome to email me.
And
Hopefully, or I guess I have to put it in the Q&A, is that right?
let's see, how do we best do that? Well, what we can also do, yeah, because I think the chat was disabled for everyone except like, well, actually, let me see. Let me see what happens if I type this in. So I'll cut and paste what you put, and we'll see if it shows up for people. And if not, we will email it to everyone. Um, and let's see. Um, oh, Karen Anderson was sharing that she's been doing acupuncture, and that's been addressing some of her sensory needs.
Great.
I guess same question. Are you familiar with some of working with clients who have been using that as well and seeing
I
success?
mean, I definitely see people that use kind of alternative forms of medicine and it works for people. And I think there's still like research that needs to be done. But if you find I mean, there is research on acupuncture that it does change your nervous system and how your nervous system processes things. So I mean, I would definitely try it if you think it might be effective.
Because that falls under the same category. Hey, if it works.
Yep.
Um, and it looks like so it does look like people aren't able to access the chat, but we what we'll do, and if this will work for everyone, we can send an email to everyone who attended with follow up, and that follow up will include Aimee's contact info. So any questions you might want to ask, not in front of the whole group, or any questions that come up, certainly we're going to make sure that we get that sent out as well. Oh, really interesting question. Hadley is asking about sensory issues with water, especially bathing and extreme sensitivity with water on the head. Any suggestions for working with that?
Yeah, I teach parents a lot of times if they have a child that has a similar difficulty, we do head massages prior to bathing. It seems to be pretty effective. Um, and again, too, I think also you can just make sure that you've prepped yourself. Sometimes it's like I'm just gonna do that for a short amount of time versus I'm gonna have water on my head only a short amount of time. So maybe I'm gonna scrub up first and then rinse, things like that. But the head massage is pretty good because it does, but do it consistently, because it will help to just normalize that tactile system a little bit more.
Oh, and Selena's asking about us getting the recording, and yes, everyone knows we recorded the whole thing, and we'll see if someone wants an audio file. I'll see if we can separate out the audio. But yeah, we've been recording right from the start. Uh, how do you distinguish? Oh, Carol's asking, how do you distinguish? And I know we're running out of time. Dude, we have some good questions still coming in. How do you distinguish between sensory integration issues and being a highly sensitive person?
Well, it's really like, a sensitive person, again, it's that spectrum, right? So you're going to have people who are just more sensitive, right? More sensitive to different types of input. That's very true. It's when it becomes an issue and when you can't do the things you want to do or things you should do, then that's when we call it, it becomes an area where we should give some intervention. So that it's, like many things that we in this realm, it is on that spectrum, and so it's just where it falls to you, and that might be for a different person. Some people are like, it's not impacting me. I just don't, I only wear certain clothing and that's the way it is. But other people, that might be disruptive to them. So
I think that's all the sensory questions that I'm seeing, unless anyone has any more. Well, I mean, again, we're gonna email out the info for everyone with the recording. Um, and yeah, we'll make sure that Aimee's contact info is there. Yeah, I want to thank everyone who attended today. The questions were really great. Really drove the conversation forward. Really great, especially really great questions toward the end. And Aimee, thanks so much for taking the time and putting together so much great information about a topic that I don't think is talked about nearly enough, and I think showing all the different facets of a topic that is not always that well understood. So, I mean,
Yeah,
thank
and
you,
it's
everyone.
a lot of information in a little amount of time. So it's a
Um,
complex topic, but try to squeeze a little bit in.
So we'll get that information distributed to everyone. So it's okay if you didn't memorize the presentation. I that's perfectly fine. So everyone who attended, look for an email. We're gonna get whatever info we're able to send out. We're gonna get that to you and include the contact info. But other than that, I mean, thank you everyone for taking the time today to be here with us. And yeah, Aimee, thanks for putting this together. This has been really, really amazing. I certainly learned a lot. And for those of you who are asking about the PDFs, we also can send that out as well. So yeah, we're glad glad that you did not. It's okay that you didn't memorize it. We'll get all the info to you in whatever format is needed. Other than that, I hope everyone has an amazing rest of their day. I hope this info helps you, whether you're a professional, survivor, family member. I'm sure everyone's taking away some stuff can that we can use going forward. Um, I'll say it again. Thank you everyone for being here. And Aimee, thanks so much. This has been really, really amazing.
Well, thank you for the invite. Thank you everyone for attending.
All right. Bye. Thank you, everybody.